Hello, I'm Dr. Erica Mitchell, and this is the Society for Vascular Surgery briefing about academic promotion and tenure. The backbone of academic reward system is promotion and tenure. One critical component of a successful academic career is to understand your institutional criteria and guidelines for academic promotion and tenure. The mission of most academic medical centers is to provide excellence in patient care and service, research, and education. For faculty members, advancement through the ranks requires demonstration of leadership in clinical activity, service to the institution, and the public scholarship and/or teaching. The weight given to each of these categories varies from institution to institution. However, the criteria are generally uniform for all faculty within a single institution and do not differ from department to department. It is important to understand what career tracks are available at your institution. The traditional promotion tracks, all faculty are expected to excel in scholarship, teaching, and service to be eligible for promotion. Other programs have promotion tracks that differ for clinical surgeons, surgical scientists, and surgical educators. Each track may have specific criteria for promotion, but the areas assessed are still scholarship, teaching, and service. Promotion requires proof of his or her creativity and productivity. The terms satisfactory, substantial, and outstanding are usually applied across the three main categories of scholarship, teaching, and service. Quality, quantity, and continuity of work consistent with the allocation of percent effort are usually considered when assessing these criteria. In the traditional tracks, achievement in all is generally required for promotion to associate professor and professor, regardless of distribution of effort. Research is traditionally the first and foremost essential form of scholarly activity. In most institutions, the definition of scholarship has been expanded to also include scholarly activity related to teaching and clinical services. Scholarship is measured by the amount of grant support and contracts you have been awarded, the quantity and quality of your research, publications, and the number of lectures, conference presentations, or professorships that you have provided. Increasing levels of achievement are given for increasing evidence of contribution to your field and include, in order of importance, original publications in peer-reviewed journals of high quality, appointments to editorial boards of scientific journals, membership in the NIH study sections, invitations to present work at workshops or symposia, sustained independent funding, and appointment to prestigious committees of scientific societies including the NIH, National Science Foundation, and the Department of Veteran Affairs. Candidates must demonstrate that they are effective teachers of medical students, graduate students, residents, nursing students, or other student populations. Achievement in teaching are recognized through teaching evaluations, teaching awards, program management, student clerkships and residency program directorship, curriculum development, student mentoring and advising, election to institutional and national educational committees, and promotion of new research and educational programs. Service activities contributing to promotion can include membership in professional societies, granting agency, review work, editorial and ad hoc review activities, involvement in committees and community service. Administration of clinical programs, development of new clinical service and clinical activity usually falls into this category as well. Clinical activity has become increasingly important in promotion process as it provides the majority of funding for most hospitals and medical schools. Achievements in service are ranked according to level of participation in the departmental, institutional, regional, national, and international committees, and the level of clinical work or service to the medical school and the scientific community. Outstanding achievement is usually only awarded for leadership roles related to service line development or long-standing membership or service as a chair on institutional or national committees of importance. It is important to understand the various promotion levels. One is usually hired as an assistant professor. The time of promotion from assistant to associate professor is between 5 to 7 years. Promotion requires that the candidate have a local reputation and some level of academic productivity. Promotion to full professor does not usually occur for 7 to 10 years after promotion to associate professor and is based on the candidate's demonstration of continued contributions to the areas outlined previously. Most institutions require high levels of clinical activity, a national and international reputation with major contribution to the specialty, and some institutional administrative time for promotion to professor. Tenure is a level of academic achievement that highlights your past and ongoing contributions and is a formal recognition of your value to the missions of your department and institution. Tenure is usually reserved for faculty with the full rank of full professor. It is not necessarily guaranteed when one reaches the professor level. Granting of tenure requires appropriate achievement and sufficient departmental funds to meet salary requirements of tenure. Guidelines and instructions for promotion should be readily available to all faculty and can usually be obtained from your departmental chief, departmental chair, and dean of the medical school. This information is usually accessible via the web. Each year, the dean of the medical school requests nominations of faculty members whose accomplishments warrant consideration for promotion or tenure. The promotion process starts with nominations from the division chief or departmental chair. One of the most important aspects of being promoted is your promotion package. Core components of the promotion package typically include a CV, personal statement of contributions, and development of current academic rank, including clinical service responsibilities and grant support, teaching portfolio or documentation of teaching, job description with time and effort statement, annual reviews, departmental promotion and tenure evaluation, and supporting letters of recommendation from within or outside of the institution. Most institutions have a promotion and tenure cycle with a predetermined timetable for candidate identification and nomination, as well as a deadline for submission of the promotion packet. Once completed, the promotion dossier is forwarded to the Departmental Promotion and Tenure Committee for review. Those approved are passed on to the Institutional Promotion and Tenure Committee. The committee is usually composed of both physicians and basic scientists who have achieved full professor and often tenure status. The promotion packet, along with other information and communications between the Promotion and Tenure Committee and the dean and/or the candidate's departmental chair, will be used to evaluate the candidate's qualifications meet the institutional criteria for promotion. In summary, promotion is an active process. At the beginning of his or her academic career, the vascular surgeon should begin planning for this process. Surgeons need to understand the promotion criteria and guidelines for the institutions to develop a timetable and plan for academic promotion.
This briefing is made possible by a grant from Cook Medical. To learn more about vascular health, visit vascularweb.org.